Thank you, Madam Chair. I also rise in opposition to this amendment that would deny federal Medicaid coverage of abortion, and I applaud and thank all my colleagues for introducing this appropriations bill without an abortion ban. Here we go again. Colleagues, do you know anything about the woman who wears this shoe? Do you know her age? Do you know whether she has children, 1 child or 5 children, whether she suffers from COVID or breast cancer or deep depression? Does she have family close by? Does her partner beat her in the morning? Do you know that she's working hard every day of the week, just scraping by to pay the bills? Here's the thing. We do not always know a woman's circumstances because we are not in her shoes. When Medicaid covers pregnancy care but withholds coverage for abortion, we are taking away a woman's ability to make important personal decisions based on what's best for her circumstances. No matter how we feel about abortion, politicians shouldn't deny someone's health coverage for it just because they are struggling financially. Each of us should be able to work and live and make decisions about our health and our future with dignity and respect. And when a woman can make a decision about our own reproductive health care, including whether and when to have children, they have more control over their economic security. Here are some facts. Studies show that when policymakers place restrictions on Medicaid coverage abortion, it forces 1 in 4 poor women seeking abortion to carry an unwanted pregnancy to term. A woman who wants to get an abortion but is denied is more likely to fall into poverty than a woman who can get an abortion. And restrictions on abortion coverage fall hardest on those who are struggling financially, who are more likely to be women of color, immigrants, and young people. Which brings me to the ultimate injustice of the current law that denies federal Medicare coverage of abortion, the law which our bill correctly eliminates. The majority of minimum wage workers in our country are women who are working to support their families, and they are disproportionately women of color. There are hotel housekeepers, child care workers, personal care assistants, restaurant servers. Although many of us would like to consider these folks to be important backbones of our economy, these hardworking women often, they don't get health insurance coverage from their employer, and they cannot afford private health insurance, so they rely on Medicaid. So to have a health care system in our country that restricts access to abortion for women striving to make ends meet is unfair and unjust. My Republican colleagues also claim that this amendment would prohibit discrimination against health care providers who refuse to offer an abortion services. Really? In actuality, it emboldens insurance companies, providers, and hospitals to use their personal or religious beliefs to determine a patient's health care, leaving patients without care, coverage, or information they need, and that includes abortion and other reproductive services. And this amendment is especially dangerous because it threatens federal funding for all health services for low-income Americans, not only those needing reproductive care. As our chair lady mentioned, it threatens states with the potential loss of all federal health funding if they try to protect patients. And believe it or not, the Trump administration actually attempted to use this type of refusal law to take away $200 million in Medicaid funding per quarter from California in the middle of a pandemic because the state ensures coverage for essential reproductive health care. Fortunately, the Biden administration reversed that decision. And I've said it before, and I'll say it again, as many times as I need to, abortion is health care, and a patient's access to health care should never be based on the belief of others. And to say some of us agreed in this amendment and passed appropriation bills is bogus. There is not, nor was there ever anything bipartisan about denying access to abortion. There are many policies that continue because of the combination of procedures and deal-making, and that doesn't make the policies right. And about your polls, nationally, Americans favor access to abortion and Medicaid coverage of abortion services. But look, this is not about polls, because a woman doesn't take a poll to determine whether or not she's going to become a mother, nor does she call her state senator or her congressperson. It's not our place to decide for someone else whether she should get an abortion. It's better that decision be made with her family according to her faith, because the decision to become a parent is one of the most important life decisions that we can make. And when people make decisions that are best for their lives, however much they earn, families thrive and we build healthier communities where each of us can participate with dignity. And I say to my colleagues, this shoe doesn't fit. I don't know what I did with the shoe. I think someone took it from me. But the shoe I held up does not fit you, so don't try to wear it. Defeat this bad amendment, and I yield back.